Seeking help for your mental health is normal and healthy, but it can be hard to know where to start. Let's talk about treatment options and support you might receive during a WorkCover mental injury claim. If you're finding things hard at work, getting support early is important. Watch our other video to learn more. If you have a work-related mental injury, a good place to start is with your GP. Your GP can do a mental health assessment, discuss treatment options with you, and issue a work capacity certificate. You'll need this if you plan to make a WorkCover claim. Your GP may refer you to see a mental health professional for further treatment. If you do lodge a claim and it's accepted, WorkCover can usually pay for reasonable and necessary treatment to help you get better. We'll also usually cover early mental health treatment while we're deciding your claim. Find out more in our other video. If your claim is not accepted, this will stop, but you won't have to pay back the costs for the treatment you received. There are different types of professionals approved by WorkCover to provide mental health treatments. Your GP can look at what we cover and recommend a mental health professional for you, either in your local area or online. Many professionals offer sessions via telehealth, which can be just as effective as seeing them in person. This may be useful if you live in a remote or regional area. Finding someone who is a good fit for you is important. If you're unsure, ask your GP for recommendations. Even if you decide not to make a claim or your claim isn't accepted, it's still important to seek support for your mental health. There are fees for most mental health treatments, but you may be able to access rebates to help with the costs. Ask your GP if you're unsure. You might be wondering what treatment involves. Mental health professionals will spend time talking with you to understand what's going on. This might involve talking you through your thoughts and feelings. They'll then use therapies to help you understand and cope with your symptoms and lower distress. Now let's look at some different types of professionals. Psychologists are qualified professionals who treat mental health conditions. Psychologists working with WorkCover usually have specific expertise and experience treating people with work-related injuries. They will usually work with you to understand your injury and circumstances, then use evidence-based therapies and interventions to support your recovery. The Australian Psychological Society's Find a Psychologist tool allows you to search by location, area of practice or issue. Psychotherapists and counsellors also support people with mental health conditions. They can specialise in areas like relationships, grief, or addiction. They may use therapies to help you make positive changes in your thoughts, feelings, and behaviour. You might also see a rehabilitation counsellor or a mental health occupational therapist through WorkCover. Find a qualified professional online or ask your GP. Mental health social workers have recognised skills and experience in mental health. They work with people in a holistic way to help them get better. Social workers understand how factors like finances, housing, employment, or relationships affect your life and work and incorporate this into your treatment. See the Australian Association of Social Workers website. A psychiatrist is a medical doctor who specialises in the diagnosis, prevention and treatment of mental health conditions. They can diagnose conditions, conduct clinical assessments, prescribe medications, and provide psychotherapy. Psychiatrists can also issue a work capacity certificate for a mental injury claim with WorkCover. You're most likely to see a psychiatrist if you have a complex mental health condition or if you're not responding to other treatment. You can also look up any psychologists or psychiatrists' registration and qualifications on the AHPRA website. Your GP or psychiatrist may prescribe medication to help manage your mental health condition and treat symptoms. Certain medications can only be prescribed by a psychiatrist. Speak to your doctor if you're unsure. You may need to try different treatments to find one that works for you. But just like with a physical injury, many people can and do recover from a mental health condition with the right support and treatment. If you have questions or need help, you can call us or visit our website. We're here to help. If you need support right now, call Lifeline on 13 11 14. If life is in immediate danger, call 000. If you need advice or assistance, you could talk to your union or contact the Workers' Compensation Information and Advisory Service for Workers on 1800 102 166. If you need support after an injury at work, you can contact the Workers' Psychological Support Service to connect with community services. Call 1800 370 732 or visit wpss.org.au to find out more. If you need help in your language, call 1800 512 451 and ask for an interpreter.